My 80-year-old grandmother has had diabetes for a number of years. I would like to know what kind of emergencies a diabetic can suffer from. How can I be prepared for them?
The two most common complications just related to blood sugar is hypoglycemia, that's low sugar, or diabetic ketoacidosis, that's high sugar, and another state called hyperosmolar non-ketotic coma. These are the three most common diabetic related emergencies. Hypoglycemia can be mild, where the patient experiences some symptoms and takes an extra helping of carbohydrates. It could be moderate, where the patient experiences a lot of symptoms and somebody else needs to treat him. Or it could be severe hypoglycemia, where the patient needs to be hospitalized for low sugars and treated accordingly. Now, moderate to severe hypoglycemia needs to be assessed. Severe hypoglycemia with patients in the elderly and patients who do not experience the symptoms of hypoglycemia is extremely dangerous. It's an entity which we call as hypoglycemia unawareness, and it's an extremely dangerous entity, and one needs to identify those patients who are at very high risk for hypoglycemia. Their treatment targets are different from the other patients, and one needs to treat them and monitor them much more aggressively as compared to other patients. The other ones are where the sugar goes up. You may have a high sugar which triggers what is called as ketonuria, where your fat cells break down and from ketone as a compensatory response. And ketonuria and diabetic ketoacidosis is a very dangerous condition and requires hospitalization. Hyperosmolar non-ketotic coma, where your blood sugars go beyond 600 and can cause mental obturations or clouding of one's mind, is another emergency condition in type 2 diabetics, and one needs hospitalization. How do we prevent high sugar? No, if you get diabetic ketoacidosis or hyperosmolar coma, one needs to be in hospital. Hypoglycemia, mild to moderate, can be treated at home itself by having a sugary drink. You today even have glucose tablets which can be incurred, but one episode of hypoglycemia should raise an alarm for the patient to go back and kind of change his treatment with his doctor. He should at least consult his doctor. Moderate to severe hypoglycemia is extremely dangerous, and one needs to either get hospitalized or one needs to go and meet the doctor as soon as possible. Hypoglycemia is low blood sugar. The most common symptoms would be headache, would be tremors, would be feeling hungry, would be sweating, would be palpitations. Anything abnormal to one's own self, one should consider as hypoglycemia. Hypoglycemia, there is a triad to call it oneself as having hypoglycemia. One are the symptoms of hypoglycemia. Two, one should check and see that the sugars are low. And three, after eating something, one feels better. So this is the triad for hypoglycemia. And many a time patients may have abnormal symptoms of hypoglycemia, so there may be some individual abnormal symptoms also for hypoglycemia. For high blood sugar or diabetic ketoacidosis or hyperosmolar non-ketotic state, there can be a stressor of probably an infection which is triggering off these dangerous conditions. Symptoms may be related to the basic underlying problem, or could be related to giddiness, could be any mental obturations to vomiting, to a stuporous state, drowsy state. All these could be but these are things one should identify early and reach hospital early.